Well, an interesting response from President Trump. His labeling of a House-passed health care bill as mean has aggravated some of the conservatives he pressed to back it, even as the Senate attempts to reshape the measure increasingly threaten to spill into July. Here to discuss it is Scott Ehrlich. He's a writer with The Federalist and healthcare industry expert. Scott, thanks for joining me on Trending Today USA.
Thanks for having me, Ernie.
What is so mean about the bill?
I don't really know. It's always hard to tell what President Trump is thinking at any given moment, so it's hard to say exactly what he wants. I mean, I know what he said. He wanted a bill that is cheaper and better and more available, which is pretty much impossible. So I'm not sure exactly, what he's looking for in terms of policy, which certainly is a strong point.
One of the strange things about this entire episode with this health care bill is the Republicans have been saying since it passed in 2010, we're going to repeal it. It's a terrible bill. It doesn't work. Some states it works better than others, but there are a lot of people who just found that their premiums doubled and their deductible went up, doubled and tripled. I mean, they're just getting no value for their money. But throughout all this, if it's such a bad bill, why not just simply repeal it and start from the ground up?
I think, Ernie, you and I seem to have this discussion every week, and I think every week we're on the same point, which is I believe that's precisely what they should do. I believe they would have paid the same, if not a lesser, political price for doing it. The CBO estimated, I think, that about the same amount of people would have lost insurance, even though I don't really take the CBO's 10-year estimate that seriously. But, again, so all the measures say not only, they would have been able to assemble it the way they wanted, and they would have saved the country a lot of money, and they wouldn't have really been any worse, I think, politically or in terms of coverage. So I completely agree.
Is this thing going to be the Republicans' version of Waterloo? Are they going to find themselves really in trouble with the electorate next year, even with people who don't like the bill, but it's the devil you know versus the devil you don't?
Yeah, I don't know. I don't know because the Democrats had a chance. They screwed it up. The Republicans have a chance. They're screwing it up. So I think you're just going to get, instead of people doing what they did in 2010 or so where people switched from Democrat to Republican, I think you're going to get a lot of conservatives just not voting and saying it doesn't make a difference because I'm getting screwed on my health care either way, no matter which party I do. And I think that's what may cost Republicans more things than losing people. I think you may fire up some of the Democrats and you may just get Republicans not voting.
Scott, whatever happened to the days of going to the doctor and actually paying for it?
I think that ended with around Medicare. I remember seeing, I can't remember the article or anything like that, but I think it showed before Medicare what the cost of a live birth was in a hospital, and it was very cheap. And I showed just inflation right after Medicare started setting prices for services, and that's what really started the spike in American health care pricing. Because again, you had central planners basically saying this is what a service should cost, and it changed that idea of you paying for your own health care and knowing what it costs and having that someone else is paying for it and someone else is setting the rate and value, and I think that really started the separation between cost and value.
Well, the same thing happens in pretty much anything where government money is suddenly thrown into things or they get involved. For example, look at the cost of college. All of a sudden, all those government loans are now available to everybody. And all of a sudden, colleges say, gee, we have to raise our tuition prices through the roof because they know they're going to get the money one way or the other.
Well, it's pretty simple. I mean, if you say you're going to pay the first $500 to something, for example, and I was charging you $300, might as well charge you $600 now because you're better off as a consumer because you're only paying $100, and you're better off as a business because you're making $600 instead of $300, and the only ones that get screwed in that sense are the taxpayer. I think that's what we're seeing in college education, that's what we're seeing in healthcare, and that's what we're seeing in just about anything that's subsidized. All
right, let me make you king of the forest for a minute. What kind of healthcare bill would you like to see come out of Congress, if any?
I've been noodling this, I think, since I started doing your show a few months ago. I just don't think federal health care reform in that sense is really something that's really possible to do something with what this country seems to want, which is what President Trump promised or said. It was cheaper, widely available, good quality health care, and you just can't have that. I think if we want to provide the most coverage, I would move that money towards more community clinics and try to get away from the insurance model and just provide more actual care. Combined with maybe some catastrophic insurance plan. I just don't think that we have the political will and consensus in this country to go towards anything really resembling that kind of pre-1965 free market healthcare sense, but I think that would be the best way to do it in a sense that you're providing everyone health care and not interfering with people that have insurance or plans or anything that they like.
Well, that's one of the frustrations I have thought from the beginning this entire Affordable Care Act was about health coverage, but not about health care. It was about getting numbers on a statistical page, but it wasn't about really providing anything because for people who watch their deductible go up to $8,000, they, in essence, if they can't afford it, they have no health care.
Yeah, no, we're paying trillions so people can get insurance cards, and that's really what it comes down to. I don't think mortality rate has bettered. I don't think any real health indicators have really bettered. I know there was a Medicaid study in Oregon which basically showed that having access to health insurance doesn't really show any value of health outcomes. So it's really a canard just to make some people feel. And certainly there are winners. I mean, I'm not going to say there aren't winners in that. I'm a diabetic, so if I decided to self-insure, I'm sure I'd be better off, thanks to guaranteed issue. But I think on the whole, you kind of made things worse for 80-90% of the country to help a few.
Yeah, I had seen my doctor in Washington, D.C. He called me. I had long since left, but he called and said, listen, I'm going to a concierge service. And it was a monthly fee, and he said, and I asked him why, and because I thought, well, this is interesting, I wanted him to come on. He said, no, I don't want to publicize this. But he said, I've had it with the paperwork. I've had it with the regulation. I've had it. So you just pay him the monthly fee, and you have access to him 24/7.
Yeah, that's what my parents use, actually. And I think of the times I've gone to my doctor in the last, 7 or 8 years, and I probably in those 7 or 8 years have had maybe a combined 30 minutes to an hour of time with my doctor, and I'm sure for those 30 minutes to an hour, him and his staff probably have to do, 20, 30 hours of paperwork, because 90% of what we talk about is what is my insurance, what does this cover, how does that work, can I get reimbursed for this, can I get reimbursed for that, they'll cover this, they'll cover that, and very little time, is he able to spend actually, administering care. I think he had to join a practice, and I know last time I went to see him, he wasn't able to take me as a insured patient because the practice, the huge practice that's way above his pay grade, had to speak with my insurance company and weren't taking it.
Yeah.
I was actually able to negotiate a cash price, which was half of what they were going to bill my insurance company. So I think we were both better off. But it, shows me how much inflation there is in Medicare and how little of what doctors get to do now is really actually practicing medicine.
Scott Ehrlich, writer with The Federalist and a healthcare industry expert, joining us on Trending Today USA. Thank you, Scott.